Alright, so this is a speech about mental illnesses. Judgment and prejudice comes in many forms. Many people are defined by illness and appearance. Mental illness does not define anyone. There are many different types of mental illnesses, but three main ones: anxiety, depression, and eating disorders. First, let's talk about anxiety. Anxiety affects 40 million adults, about 18% of the population. It affects 8% of children and teens. Many people are diagnosed before age 21. Anxiety affects 60% more women than men. It usually consists of unnecessary fear. The emotional symptoms include dread, tenseness, jumpiness, restlessness, and feeling like the worst is always going to happen. Physical symptoms include racing heart, upset stomach, sweating, twitches, and headaches. There are four main types of anxiety, including panic disorder, phobias, generalized anxiety disorder, and social anxiety disorders. Specific causes for mental illness is unknown, but it is most likely caused from genetics or their environment. Diagnosis includes a physical examination to rule out a physical disease or illness, an interview to determine factors, lab tests, and using the Diagnostic and Statistical Manual of Mental Disorders. Treatment for anxiety includes psychotherapy, medications, and stress techniques. Although the two can mix, depression is another illness that affects many people. Early detection of depression is very necessary to start treatment. Untreated, depression can be devastating. Some people experience depression once in their life. For most people, it recurs. With depression, risk of suicide skyrockets. 16 million adults reported depression last year. Suicide is the 10th leading cause of death. Each year, 44,193 people die from suicide, and for every successful suicide, 25 people attempt it. A reported 494,169 people are hospitalized for suicidal attempts and self-harm acts every year. On average, there are 121 suicides a day. Women are 70% more likely to develop depression than men, and young adults 18 to 25 years of age are 60% more likely than those over 50. Symptoms include changes in sleep and appetite, lack of concentration and interest, loss of energy, low self-esteem, hopelessness, changes in environment, and physical aches and pains. As with anxiety, causes of depression are unknown. Some factors may include trauma, genetics, life circumstances, and brain structure. Other medical conditions that may play a factor with depression are sleep disturbances, medical illnesses, chronic pain, anxiety, and ADHD. ADHD is attention deficit hyperactivity disorder. Around 6.4 million adolescents were diagnosed with ADHD in 2011, and that number continues to increase. Persons with a history of drug and alcohol abuse are 30% more likely to develop depression. Common victims of depression are men, women, LGBTQ citizens, and children and teens. Women's hormones are constantly changing. Postpartum depression, which happens after childbirth, is very common among women. Men are 4 times more likely to commit suicide from depression because they may feel ashamed of their symptoms. The LGBT community is widely discriminated against, causing bouts of depression. Suicide is the 3rd leading cause of death, ages 15 to 19. Many of these suicidal deaths are results from depression. There are many treatment options for sufferers of depression, including medications, psychotherapy, brain stimulation therapies, light therapy, exercise, alternative therapies, self-management, and mind-body-spirit approaches such as yoga and acupuncture. Depression may be the problem, but suicide is not the answer. And lastly, eating disorders. Eating disorders affect 1 in 20 people at some point in their life. An estimated 10 million women in America suffer from some type of eating disorder. 77% of people with eating disorders say that the illness can last from 1 to 15 years or even longer in some cases. Eating disorders hold the highest death rate of all mental illnesses. There are 3 types of eating disorders. The first type is anorexia nervosa. 1 in 200 American women suffer from anorexia. The physical symptoms are self-starvation, refusal to eat, binging and purging, and overexercising. The emotional symptoms are irritability, social withdrawal, lack of mood or no emotion, fear of eating in public, obsessions with food or exercise, and lack of understanding about the seriousness of the disease. 5 to 10% of people diagnosed with anorexia die within 10 years. The second type of eating disorder is bulimia nervosa. 4.5 2.2% of females suffer from bulimia at some point in their life. It includes out-of-control eating, followed by desperately trying to rid oneself of the food just consumed. This results from forced vomiting, abusing laxatives, and excessive exercising. Physical symptoms include acid reflux, dehydration, and cardiac arrhythmias. It can also cause problems eating and digesting food and damaged teeth from vomiting. Emotional symptoms include low self-esteem, feeling out of control, feeling guilty, and withdrawal from loved ones. The last eating disorder is binge eating. Binge eating is similar to bulimia but without running of food. The person loses control over eating. The person may eat large amounts when already full or not hungry at all. Emotional symptoms are embarrassment, disgusted feeling, depression, or guiltiness. The person does not purge. This is the difference between bulimia nervosa and binge eating. The person can be normal weight, overweight, or obese. Some causes of binge eating are genetics, environment, peer pressure, or their emotional health. Only 1 in 10 people get the treatment they need for eating disorders. About 80% of people who do get treatment do not stay long enough to remain in recovery. The price of treatment for eating disorders is about $2,800 per day, about $30,000 a month, and many people need 3 to 6 months worth of treatment to remain in recovery. Eating disorders affect many people. It is the silent killer of many individuals. There are many types of mental illnesses, each with their own specific types, symptoms, and possible causes, including panic anxiety, phobias, generalized anxiety disorder, social anxiety disorders, depression, anorexia nervosa, bulimia nervosa, and binge eating. Mental illness does not define anyone. Speak up, speak out, and get someone the help they need.